Hi, I'm Dr. Bill Adams. This is a special edition of Deep Dive. This is where we examine topics that need a little bit more detail and perspective. And this is a very special program, one that many patients and doctors alike are really wanting to know more about. And that's heavy metals and breast implants. This is a 30-year perspective of a toxicologist, and we have an incredible guest expert, Dr. Roger Wickstrom. Roger, I've known you I think 20 plus years, right?
20 plus years, yep.
But Roger, really is one of the world's leading toxicologists. He's a PhD in pharmacology and toxicology from the University of California, Davis. He's a 2-year postdoc fellowship at UT Southwestern Medical Center here in Dallas. He spent more than half his time for the last 30 years focused on the evaluation of safety and clinical performance of breast implants. As I said, we've known each other for 20 years. We've worked together a lot. I've heard Roger present on numerous topics and always learn something every time. And I think, Roger, we both have a passion and interest in things like subclinical infection and biofilms and how to address them. And we've also all testified at the FDA panel hearing. So it's great having you here.
Great to be here.
And we're going to talk about this topic that's really come up. It's been something that's been around for a while, but certainly resurfaced this year. And that's the question of heavy metal content in breast implants, what's safe, many patient questions, doctor questions, so it's going to be great to have your perspective. Mm-hmm. So our objectives today are going to be to share this with you and equip surgeons to address patient questions on this topic, to understand what the issue is, to share what we know and what the science tells us, and finally Roger's going to tell us what further information and resources will be coming soon. So Roger, this is a big issue, a lot of questions, but what is the heavy metal issue?
Well, I think to succinctly describe it, it's the thought that if you look online, there's descriptions that breast implants contain toxic heavy metals, and those toxic heavy metals are making those patients sick. Right. That's basically the core issue there.
Yeah. And, is this something that's new? Is this a new issue?
It's actually not. If you go back to the 1990s, much of the same type of questions and issues were being raised back then and were addressed. And then actually in the mid-2000s, around the time of the FDA panel hearing, these same questions arose back then. And in fact, partly to address those in one aspect of it, the platinum, which we're going to talk about, Scott Spear actually asked me to write a review article back in 2007 on platinum and breast implants, which is still as timely today as it was back then. So it's an issue that seems to keep cycling back every now and then.
And I think we're in a slightly different era now. There's things like social media, and there's just more interchange of information. Roger, I know you're an expert on social media, but that's a whole nother deep dive. But
right.
But yeah, so it's definitely something that has definitely resurfaced, particularly in the past 12 months. Why do you think this is a re-emerging issue?
I was really wondering why myself, and I went online to see if I could figure out, why it had disappeared for quite a while and just now it was reemerging. And so I looked around and I found on one of the websites focused on what's termed breast implant illness, I noticed on the homepage there was this tab for heavy metals. So I clicked on that, and sure enough, the first line on that page said, scroll below for a list of the heavy metals used in the manufacture of the current FDA-approved breast implants. And if you scroll below, there's a table, and we have a copy of that up there you can look at, and here's a long list of heavy metals. Now, I recognize this table because it was from an FDA document that was released on the day of approval of the breast implants and that. But if I didn't know the background, and I read that sentence about the heavy metals used in the manufacture of breast implants, I would think this was an ingredient list. If I'm going to make a breast implant, I'll add a little bit of arsenic, some lead, some mercury maybe to give it a little bit more of a shine or that. But no, that's not at all what this list represents. And in fact, what was presented on that website is really only half of the information that's on the FDA site. They left off the right-hand column of the table. And that column is critically important to I think a lot of the discussion we'll have tonight, and that is the concentrations that are present. So, so the question comes up, if this isn't an ingredient list, then why is this list of heavy metals on here? Because it is in an FDA document on breast implants. And the reason is, whether you're talking about a number of different types of medical devices or pharmaceutical drugs, and that heavy metals are in so many things in our surrounding. They're in our air, water, food, and that FDA requires that manufacturers test their products to make sure that the levels of heavy metals, which can be in raw materials too, are below limits that are well recognized to be safe. So that's why these are there. And on the site, you'll see similar, but a little bit different tables from different manufacturers' implants. But that's why they're there. And if you look at some of these levels, for instance, barium, for instance, it was 0.001 parts per million in the implants. And if you compare that, New York City water supply, which is actually considered one of the better water supplies in the world, and that it's 20-fold higher in the water. And then if we go to another one, chromium. We saw it at 0.028 parts per million. Well, if you look at green tattoo ink, that's 26,500 parts per million of chromium in that. And then last example on this table we'll give is mercury. Okay, I think we've all heard about mercury in tuna, and it's kept at low levels, but even in your average can of albacore tuna, it's got about 90-fold higher levels of mercury than what we're being measured here. So the issue is not whether the heavy metals are present at some low level that they're detecting, but what does that mean? And I think we'll get into that discussion a little bit.
And so this is actually from a breast implant. This is from a breast implant report to the FDA, right?
Right.
And so all these different things are used. Some may be used in the manufacturing process, but it's not necessarily contained within the implant.
So the only ones on here, so platinum, as we'll talk about, platinum is a catalyst that's used in the manufacturing of breast implant. And for those who remember back to their chemistry days, a catalyst is something that accelerates or speeds up a reaction, but isn't consumed as part of it. So what you add is what you have at the end. So you know what's there on that. Tin has been used in the past in some implants, but the other ones are not ingredients. They're trace levels of heavy metals that you'll find in so many products. And this document that you're looking at, the table on the right-hand side, is actually a document that's generated by the FDA. Mm-hmm. So they look at these numbers and they compare them and look at them in comparison to well-recognized safety limits.
And when patients ask, well, how do you know their trace levels? Those
Right.
are things that they're standards by various agencies that tell us what trace levels are.
Right, right. And I think later on, I think we'll show one example of that. So there's an International Conference of Harmonization that is a cooperative effort from regulatory agencies from Japan, the United States, from Europe, I believe Canada, and elsewhere in that. And they've come together and put together these documents where they come to a consensus on what these safe levels would be.
Okay. So Roger, I saw a patient today who said she had a test result
Right.
that was positive for a heavy metal, and she has a breast implant and is concerned. So what's your opinion about that, and how do we best handle that question?
Okay, so, I think, one of the things is to explain that the fact that a test comes back, whether it's a test of urine or a test of blood, comes back showing the presence of heavy metals is not a surprise. In fact, the Centers for Disease Control has been running this study for years and years called NHANES and part of that, they do urine tests for heavy metals for a sampling of the US population and sure enough, they find heavy metals at very low levels. We have them because we're exposed to these heavy metals in food, in drinking water, in air, in pharmaceutical products. Cosmetics have heavy metals. There was an FDA report just on lipstick focused on lead, testing 400 different brands and varieties of lipstick in that. And it is in medical devices. So the fact that one has metals is not a particular concern. We'll talk about later the fact that some of these metals are essential elements that we need to survive, and if you look, for instance, on a package of women's one-a-day vitamins or women's Centrum vitamins, several of those metals that you saw in that earlier list, you'll find them there.
So based on what you're sharing with us, these different metals, these trace levels, are really ubiquitous around things that we're exposed to on a daily basis.
Exactly.
Okay.
And there's other exposures that, for instance, so the question comes up, like you said, with that patient, okay, if they have metals come back in urine or blood or whatever's tested in that, and some of those reports may say, oh, this is higher than it ordinarily would be. You have to ask the question, well, where did it come from? Okay, and there are a number of other sources for individuals who you would expect to have higher levels of specific heavy metals. For instance, people who smoke. It's very well documented in a multitude of studies that will elevate the levels of certain heavy metals. We talked about tattoo ink is another one. Another one that as I was looking through some information to come here with you was a bit of a surprise. As it turns out, people who are on a gluten-free diet tend to have particularly higher levels of a particular heavy metal, arsenic. And it's because most gluten-free diets have a higher portion of rice products in the diet and that. And depending on which variety of rice is being consumed, it's well recognized that can be a source of arsenic. So there's these, other sources. So just the fact that you have it in blood or urine, you don't know where the source is. And the important thing is, where is that in relation to levels that have been established as safe?
It's fascinating and bad news for those of us who are trying to eat low gluten,
Right.
So I think another question that many doctors and patients have is, isn't any level of heavy metal a bad thing?
No, and that really sort of goes to, I think, one of the issues with this, not just with breast implants, but with a lot of products, including a lot of food products, is a common misunderstanding especially in what you see in a lot of media reports. And for toxicology, the basic principle of toxicology is referred to as dose response. And it was actually first developed by this physician, Paracelsus, back in the 1500s. And the way he expressed it was, all substances are poisons. There is none which is not a poison. The right dose differentiates a poison and a remedy. Well, that's how you would say it back then. But if we bring that sort of up to modern language, the way I would say it is basically any substance at sufficiently low dose will be safe. And conversely, any substance, and I do mean any substance at sufficiently high dose, will exhibit toxicity, including water. The issue is not whether you've been exposed to a particular chemical or you have that in your body, but where does it lie along that continuum for a dose level that you would not expect to have any effects whatsoever to one that could produce toxic effects. And just to give you an example, I mean, we talked about a lot of heavy metals we know are essential nutrients in that, including cobalt, copper, chromium, iron, magnesium, manganese, molybdenum, nickel, selenium, and zinc. And this concept of dose response, I think if people stop and think about it for a minute, they already know, they're already aware of that basic principle. I mean, if for aspirin, for instance, example, if you take 2 aspirin and that may cure your headache. If you consume the whole bottle of aspirin,
probably not a great thing.
Yeah, not a good thing. You may not be long for this planet. So So that is a really important concept. So then what, for instance, what do toxicologists do? What do people who are evaluating the safety levels do? Well, what they do is they look at a range of studies. Some may be done in different organisms in that. Some may be based on epidemiology studies in humans. And they look at the data for particular chemical, particular element, in this case metal, and assess what the safe levels are. And this group we were talking about, the International Conference on Harmonization, which includes FDA as one of the partners and other regulatory bodies around the world, for instance, they came up with a guideline specifically for metal impurities in pharmaceutical products. And they established what are termed permissible daily exposures. Now, if you're consuming it in your food or consuming it orally, it's an oral drug, that will be different because not all of it may be absorbed. They have levels for that. They have levels if it's administered parenterally via injection into the bloodstream or via inhalation. And so taking these numbers and adjusting for the route of exposure, for instance, an implant is already inside the body, one can then assess what would be a safe level for these metals.
Is there a crossover from this chart in terms of an implantable device? You know, how does that translate for some of these things, say, compared to the oral or parenteral or inhale? Because they're not, those don't fall into those columns.
So the parenteral, where it's injected in the bloodstream, or the inhalation would be closer to an implant because those are already sort of inside the body. They're past the barrier, you know, for instance, of the GI tract that you have with the oral ones. So just basically the steps you would go through is, so we have from the data that was submitted to FDA, you have the concentration of that metal, the parts per million, and some of the studies are parts per billion, and then you consider what's the size of the device. Then you can calculate the total amount that was in the device and then you can compare that against these levels. Now, if you have a substance in the device, it's not all going to exit that device in one day. In fact, some of the materials that have been studied for breast implants are in there for decades, literally decades. But that's how you would do it. You'd figure out how much is in the product and then compare that to, for instance, a permissible daily exposure level.
Are you aware, has anybody done any of those example kind of calculations or estimates on breast implants based on that info?
So they have. I don't know if they're in the published literature, but it would be, but one of the things we'll talk about in a minute is I think how some of that information I think will be shared in the future. But I can tell you, any manufacturer that's submitting their data package to the FDA to get approval of their product, whether it's the pharmaceutical or the medical device, including breast implant, they have to directly address, okay, this is the level of substance X, a metal or whatever that we observed. Here's what the safe level is, and here's the data to support that that's what the safe level is.
Okay, that's great information. Okay, I want to switch gears a little bit. You had said that most of those heavy metals that have been listed were really not ingredients in the implant, but you said platinum was. So tell us more about that.
Right. So as I mentioned before, so platinum is a catalyst that's used in the manufacture of the silicone polymers, both for breast implants and for a lot of other medical applications as well. And as a catalyst, it accelerates the reaction, isn't consumed as part of it. It's added at low parts per million levels, and what's added is what's there at the end. So then the question becomes, is that safe? So if we go back all the way back to the 90s, one of the things that certain individuals were putting forth back then is, well, you know, don't you know that platinum is used in chemotherapy drugs, and those platinum chemotherapy drugs can have some pretty significant toxicity in that. So how can platinum be used for breast implants? Okay, well, it's because different forms of platinum are very, very different. The types of platinum that are used in the cancer chemotherapy drugs tend to have a +2 or +4 charge or valence, okay? And that directly impacts how the biological effects of that and the response to that. In contrast, the platinum that's used as a catalyst for breast implants is in the zero valence state. It has no charge. And we know that for a couple reasons. First of all, we know that because the chemists will tell us that the reaction wouldn't work if it wasn't zero valence. And that is the most biocompatible form. It's what you find in jewelry. It's what you find, for instance, in electrodes that are used in various medical devices and that. One of the reasons we know it's in the zero valence state is because this question came up several times over the years.
I remember.
For the FDA panel hearing that was in 2005, prior to that panel hearing, an academic researcher from Georgia actually took the catalyst, the actual catalyst that's used for one of these breast implants, and it's described in the paper here that you see, and what they did is they actually got time on the linear accelerator at Lawrence Livermore Laboratory, where sometimes you have to wait weeks to months to just have a short period of time you can use it. And what they did is, if you're going to figure out what the charge on this platinum catalyst is, how you do it is you fire high energy particles at the nucleus, and you knock out the electron that's closest to the nucleus. And the amount of energy it takes to knock away that electron is proportional to the charge of the nucleus. And so to the limit of detection, they showed that it was all zero valence, which was very reassuring in that. And that was actually presented and discussed at the 2005 FDA panel hearing. Now, because platinum, again, was coming up as quite an issue at that time, FDA actually put on their website too, and what they called an FDA backgrounder on platinum. So, and there's some other published articles in the literature, but this article that you see here actually is still applicable today.
Yeah, I remember that. I remember that the late, great Scott Spear, I think, had you write that article.
He did.
It was very helpful. It was very helpful. And then the catalyst, and you stated this earlier, but I think it's important. The catalyst means that it's present in the vulcanization of the shell of the implant and other things, but then it's still there after the vulcanization. But there may be a small portion that's transferred or not.
So it basically is there in the silicoelastomer shell and the gel material. And in studies, and this is described on the documents that FDA produces when they approve devices, studies show that more than 99% of it remains within the implant and stays within the implant.
Okay, well, Roger, this has been really a lot of great information, a voluminous amount. And so let's just summarize for the audience what the most important points are in your opinion.
Okay, so I think of what we talked about today. First of all, that list of heavy metals that was out there as a list of what was purported to be ingredients used in the manufacture, those aren't ingredients. It's trace amounts of these heavy metals that are in so many products, the air, water, food, and that. So they're also present at levels, and it's documented if you actually look on the FDA, in the FDA documents, they're present at levels below those of toxicological concern.
And in context, even far below the levels of things that we drink every day.
Right, what you find in drinking water, what you find in commonly consumed food items.
Yep.
It's true. And the other thing is the elevated levels of certain heavy metals in some patients are attributable to different lifestyle factors. That can include smoking, which there's a multitude of studies that have documented higher levels of heavy metals in people who smoke. Okay, there's also some actually that suggest that is also true for people who vape. Okay, that there's significant heavy metal exposure associated with the e-cigarettes, the vaping, and that. And then, as we talked about, sort of the curious finding on even a gluten-free diet may have elevated levels of at least one particular heavy metal. Tattoos is another one we talked about, the chromium. So those are the rest of the list. Now the platinum one, as we mentioned, that is an ingredient. It is a catalyst. It's present at very minute levels, and it's platinum in its most biocompatible form. So really in terms of understanding in this, and I think something that would be helpful in terms of understanding a lot of media reports, is this basic concept of dose response. That just because something that can be associated with adverse effects at high levels of exposure in a product doesn't mean that it's present on safe levels. And an example I think we've talked about before, I remember when I was growing up, one of the media stories at the time was, it's sort of a sensational story. Did you know that the ice cream you eat has an ingredient that's used in rocket fuel? Okay, which sounds horrible and I believe, if I remember right, the ingredient was propylene glycol. And that is generally considered quite innocuous, and that when administered orally, and it's even used as sort of the control test in various studies. So yeah, it's used in that, but that doesn't mean that it itself is a problem.
Yeah, well, I think that's it's great context, and I think that again, you've really detailed that in a scientifically valid way, that it's this context that we need to really understand some of these things that are sometimes in a vacuum, they look one way, but with the correct context, then they make perfect sense.
Right.
So
now we do have some more information.
Yep.
I think that will be coming forward on this. So one of the things that we discussed is a lot of the information we talked about today and some additional information we're going to try and capture in a publication in one of the plastic surgery journals in the immediate future. And then this is a question that a lot of patients have asked. And so I'm also involved in a prospective study. It's funded by ASERF, the Aesthetic Surgery Educational Research Foundation, along with 5 surgeons and 2 pathologists. And we actually have a study that includes control groups, and we will actually be using state-of-the-art methods to analyze for metals. So we'll be producing some additional information from that study as well.
Well, Roger, that was fantastic. You've been doing great work for 30 years and you're still continuing to do that. And it's so clear on a very difficult topic, one that we almost daily get questions from patients or other doctors. So I think the viewers will really appreciate your perspective. We appreciate your time, and thanks so much for coming.
Thank you for inviting me.
And this is another deep dive where we look at hot topics that deserve a little bit more discussion and clarity. And if you want to see more of that, you can see it on theplasticsurgerychannel.com.